Welcome to Same Surgeon, Different Light. This is part of the Society of Thoracic Surgeons Surgical Hot Topics podcast. My name is Cherie Erkmen, and together with Sara Pereira, we will meet cardiothoracic surgeons from across the spectrum of our rich community. We'll learn about backstories, career challenges, and what makes each cardiothoracic surgeon unique and valued. The opinions expressed in this podcast are those of the participants and do not necessarily reflect the views of the Society of Thoracic Surgeons.
Same Surgeon, Different Light is brought to you by the Society of Thoracic Surgeons Career Center, where you'll find free access to cardiothoracic surgery jobs, career development tools, and professional guidance. Visit the STS Career Center at careercenter.sts.org.
Welcome to Same Surgeon, Different Light. I am Dr. Sara Pereira, along with Dr. Cherie Erkmen. We are excited to record this podcast live in Los Angeles at the STS 2025 annual meeting. Our special guest today is Dr. Stephen Yang, Professor of Surgery and Thoracic Oncology at Johns Hopkins University. On today's podcast, Dr. Yang will discuss how we can further diversify our specialty through initiatives such as the Looking to the Future Scholarship, and how providing medical students and residents with mentorship, networking opportunities, and exposure to innovation at the annual meeting can inspire more students to pursue cardiothoracic surgery. We will also hear about his personal interests and hobbies, as well as how he continues to stay in touch with his very first mentor, his high school biology teacher.
Hello everyone, welcome. We are the co-hosts of the podcast Same Surgeon, Different Light. And our podcast originated with Tom Cook and Tom Varghese and the workforce on diversity, equity, and inclusion. And Sara and I took over. We have very big shoes to fill, but our mission is to share the stories of a diverse population in CT surgery so that everybody can see how rich we are by having diversity. And to that, we are so pleased and honored to have both a dear friend and mentor, colleague, Dr. Yang. I think we all agreed that we were going to shorten the bio and try to focus on him because he's been so humble. But anything you want to add, Sara? Did I leave any?
I just wanted to thank STS for sponsoring the Same Surgeon, Different Light series. And we could think of nobody that we would be more honored to talk to today at the STS meeting than Dr. Steve Yang. So Dr. Yang is a professor of surgery at Johns Hopkins University. He really needs no introduction. He's been there his entire career and has been a huge mentor and role model for me personally, as well as hundreds of medical students, residents, and fellows.
And one word, we're recording this live in Los Angeles at the 2025 meeting, and we do want to acknowledge the loss and hurt that people have had because of the fires. So, but moving on to our talk, I think one of the things that are you can see it with our president being a woman. We're seeing the Nina Braunwald Foundation and its birth in the last few years. And also we have data from a presentation at this meeting that the number of women in cardiothoracic surgery is increasing at the trainee level and the faculty level. So, what do you think we can do? What can we learn from success, and what can we do to further the diversity by gender, race, socioeconomic background, geography?
Well, first, thank you all for having me. I'm very honored to be here. I never thought I would be in this type of interview session. Well, I think we are making strides. It's slow. I think for the women, if you look at some of the data, and I'll be presenting some tomorrow, we are making strides in the number of women at least taking the exams, so it's about a third. The diversity issue, I think it goes back to the medical school. And so yes, we are having some issues trying to match the population, but I think we have to recruit better in the medical schools, because that's where we get the seeds from for surgery. So we try to do a little bit better outreach to high school students, those of us who have colleges associated with their universities. We do try to outreach with them as well. So it does start further back than residency. It has to go to, as I said, I think it's high school and college.
And a follow-up question to that, how can we as CT surgeons, like you said, do some outreach and look at our undergrads and med schools, but what can we do in our own environment to make sure that we value and keep diversity as a priority?
Well, we've already talked about diversity so much that I think it's on everybody's mind. It's not that it's a second thought now. I think most leaders in our field do have it at the top of their priority list. And so as we're hiring, as we're looking for fellows, looking for residents, and some of us interview in medical school, I think that transpires the whole educational continuum where we're trying to attract a more diverse field. So we as surgeons, we as CT surgeons, obviously it's hard for us to spend the time in the community to do that, but I think younger faculty, I think it's a great way if you want to do education to get involved in the medical school. It doesn't necessarily you have to teach medical students or teach residents, but getting involved in the medical school applications early is a great way to work with diversity and also speak a little bit for our field as well.
Thank you.
Dr. Yang, you were really instrumental in starting the Looking to the Future Scholarship Program in 2006. So in the next year, we're going to have our 20th anniversary of the Looking to the Future Scholarship Program, which is why I really wanted to interview you at this meeting. So in the next year, we will have over 700 scholarship recipients. 40% of those have been women, and 60% of those have stayed in cardiothoracic surgery. So what do you think has made that program so successful, and why should STS sponsor it for another 20 years?
Well, we originally started Looking to the Future because, believe it or not, there was a time when there wasn't a lot of interest in CT surgery. There was economic pressures. Surgeons were not retiring. Cardiology was taking away some of the cardiac procedures, and so there was a rumor out there that cardiac surgery was dead. So this was in the early 2000s, since we had to figure out how do we re-attract these students and residents, and so that's how we started the program. So over the last 20 years, it's really grown. I appreciate the STS for continuing to fund it. It's a bit of an unfunded mandate. I think it's important that we continue to bring the best and the brightest to our meeting. I'm proud to say that I've looked at it. This is actually the first scholarship in surgery or any of the major medical fields to bring residents and students, and there's other copycats out there now, vascular, neurosurgery, and all that. So I think we should be proud that as CT surgeons, we were the first to bring residents and medical students purposefully to the meeting. So I think the diversity of the population has grown, so I think that's important to show that we are not just one gender, one race, and actually try to dispel some of the other rumors that are going out there about CT surgery. So it's important not only to keep the interest in the residents and medical students, but also to show them that we do have a very diverse population here at the meeting. I still think it's very important to continue the program. Another reason we started it is that there's not access to great CT mentors and programs or rotations at every institution. I mean, it's growing. The osteopathic schools are having that, and we're starting to bring in osteopathic students and residents. So I think it's still important to outreach to those other programs. So again, the drive of this program is to actually provide those people with access to mentorship, access to potential rotations, meeting the great people here at the STS. So hopefully they will. And I think at least the leadership that I know, they still love the program.
Yeah, and with the program over the last 5 years, we continue to see an increased number of applicants to our residency and fellowship programs. Our match rates into I6 are in the 20 to 25th percentile, and fellowship match rates, are more competitive in the 60th percentile. So if I was your first-year medical student at Johns Hopkins, eagerly knocking on your door, what advice would you give me?
Go see somebody else. No, I think, I've told this, and just another example how to get involved. I give the first clinical lecture on the second day of medical school to the first year medical students, and it is just wildly exciting to do that. So I have not one, but sometimes 30 people knocking at my door or emailing me. So I think it's important for them to get the full picture of what a CT surgeon does. This isn't just the surgery. I think they all get crazy-eyed about the operation, but what we do on the outside the operating room, we have administrative duties. We go to clinic. What activities do we do outside the hospital? To try to invite them, we actually invite them to our journal clubs. So they sort of get the full picture, because at that stage, all they know about CT surgery is doing heart operations and lung resections. So it's important for them to see the big picture of the surgeon, and this meeting is a little bit of that. But we get them engaged and try to get them into research. We tell them about all of the scholarships that are available in CT surgery, not only with this organization, but all the other organizations. We have, at least in our institution, we have a very heavy presence of women. And so we do get them involved in women thoracic surgery. So we ask them to really get involved at the national level also with us. And we do get them into shadowing programs with our faculty. We do try to spread the wealth a bit, so not just one faculty, but they actually try to go see the other faculty as well.
You've had a really elite career. You've had so many different leadership roles. You started at Duke University. You actually took a little path through Virginia, then Texas, then Maryland. So who was your first mentor?
Well, I was sitting in the plenary session with the interview with Dr. Dowda the other day, and those of you who know me who've been to the Southern Thoracic know that actually my first mentor was my biology teacher.
High school?
High school.
Elementary. Uh-huh.
She was my ninth grade high school teacher.
Do you remember her name?
Yeah, Othelia Winfield. So hi, Miss Winfield. I brought her to my meeting. So I usually bring her to like the big meetings, and so she was really influential on me to not only get into science, but she was such a great teacher. I never thought I would be in education, but I always remember her as just a wonderful person who would take the time to explain and spend time with the students, and so I really had thought about emulating her as a teacher. Then over the years, it became, I don't want to go through my whole life. There was Dr. Brooks at MCV, who was my mentor in thoracic surgery. Went on to Houston. Jack Roth was my research mentor, and his wife, Elizabeth Grimm, I worked in her lab in immunotherapy, and she really taught me what was hot in immunotherapy 30 years ago. And then also Jemmy Olak, she's not as well known, but she was actually one of the first women thoracic surgeons here in the country. So she taught me how to do transplants and VATS. And then over time, you get a core of mentors as a faculty member nationally. So there's too many to mention, but as I said, I go back to my biology teacher, Ms. Winfield.
Yeah, I think that's amazing. I think all of us have that one person or that one moment where our life changes its course, and I think it's really cool that you remember her name.
And she's still alive. I send her flowers on Teachers' Day, Teachers' Appreciation Day, and so I still remember. We're very close.
We have a lot of medical students and residents and really young, talented people entering our specialty. And one, do you keep in contact with all of your mentees or most of your mentees? And two, how often should we keep in contact with our mentors or mentees?
Yeah, well, I think over the decades, I think I've trained about 150, and so it's really hard to keep up with all of them. I don't force myself on people, so if they want to stay in contact, they want additional mentorship, I try to provide that with them. We have our own mentees at our institution. At this meeting with the Looking to the Future, I stay in touch with a handful. It's hard. Obviously it's hard. But I do try to pick out every so often, when I'm sort of going through my CV and I list the names, I'll also check to see what they're doing. But I think, if the students and residents these days are, they're a little more savvy, they're a little bit more aggressive on the good side, they'll reach out. They have no fear. When I was at that age, man, I would never talk to any of these people, let alone be in the same breathing space as them. But I think over time, CT surgeons have become a kinder, gentler group. I think we're very approachable, at least most of us are. I think we as mentors, I don't push myself on, there's different models. Obviously, if you find a resident or a student that you really want, or you want to try to attract them to your own institution, you may drop them a note. But I think with the program, we've tried to keep, with the Look into the Future program, I think we've tried to keep in touch with some of the mentees. It's always hard to, because their emails change a lot. Certainly with the fellows and residents and even the medical students, we do try to get them together every so often just to see how they're doing. But I think sometimes it's reliant upon the mentee to reach out for help. Much like we've talked about, like Dr. Romano's address yesterday, you got to reach out when you have trouble. It's such a good time if you're a mentee and you're not quite sure what to do, just to reach out to your mentor that you've established contact with. I give my cell phone to the mentees at this meeting, and obviously all the residents and students back home have it, and it's a lot easier for them to text me than to email me, so they'll text me and I'll shoot them a quick, how you doing?
I often admire your fashion at national meetings and at all of our committees. Dr. Yang is always looking impeccable. So I wonder, what do you do on the side of meetings to put your sweatpants on and clear your mind from the esophageal injury or a mistake that you may have made? What's your release?
Like some of you know, my wife and I do ballroom dancing, so that's one release. It's a little known fact. I love to cook, so I'll go home and I think that's a really good stress relief. It's just to go home and my dream out there is to be on Chopped. So I go home and I play Chopped. I find what's in the fridge and I try to cook something in 30 minutes. I read a little bit. I work out when I can. I try to walk. Actually, walking is great. I'll do that in between cases. Very therapeutic. It's part of the mindfulness that was very popular several years ago. I still sort of practice it. So, between cases, especially if there's not a lot of paperwork or things to do, I'll just actually put on my AirPods and walk around the hospital and decompress, get my steps in. And my little dog at home, I go home and play. So usually I just get home and just unwind and not talk about stuff at the end of the day. So, but my mom always told me to dress nice.
Oh, I know.
So I always go back to my mom. It's my mom's fault. So that's what she always told me to do.
If you went back, say, 30 years, is there anything you would have done different in your career? Any different path you would have taken?
No, I often preach this. We always have aspirations, we always have goals, we always have things like, gosh, I want to be this. At one point I always wanted to be a chair, and then I saw what a chair does, and I didn't want that job. So I sort of let God and fate sort of take me where I want to go. Things happen for a reason. You don't get a position because of this, because there's something else better that's going to go on. So I'm not sure I would do anything different. I think one thing, again, it probably wasn't fashionable back then. I would have, taken more time for myself. I would have taken more time with my family. Probably say a little bit more no's. But you're young, you want to do everything right, you want to say yes to everything, you want to go to, be part of every committee, everybody asks you to do stuff, so it's often hard to say no to that. But I think, at least as a thoracic surgeon, maybe also as a cardiac surgeon, you can pretty much budget your time, as you all saw from Dr. Romano's talk yesterday. Yeah, you can budget in time. You put in those appointments. I mean, I didn't do that a lot. I still don't take care of myself as well, but I think you need to do that. Put that in your schedule. Put your family in your schedule. Luckily I have a great wife, and she's taking care of the kids, and luckily they've grown up fine.
Yeah, I agree with your comments. So we have one question that we've asked all of our podcast guests so far this season, and that question is, where do you see cardiac and thoracic surgery going in the future? So over the next 30 years, if you practice 30 more years, what will all of our students and residents that we've mentored be doing?
Well, we just keep adding the technology, and so I can't speak much for cardiac, maybe a little bit cardiac. I think minimally invasive surgery is the way to go. We'll be doing more and more robotic surgery as the instrumentation gets better in thoracic. But you cannot forget how to do an open operation. You cannot forget how to do video-assisted surgery. So your armamentarium is actually just going to keep growing and growing and growing. And I guess what I fear is that we do it right now, that we're going to start subspecializing or sub-subspecializing. I'm just going to operate on the esophagus. And some people do that. I'm just going to operate on the mitral valve. Some people do that, but then they'll have an armamentarium of doing it open or robotics, so they'll have the technique down for it. And what I'm happy to see is that we're having a growing number of educators. Okay, dedicated educators like Dr. Pereira, who really, they're taking the torch. We sort of started it a little bit, my generation, and it's really, I'm happy to see that There's a number of faculty, and you know, I get a lot of emails from residents who are interested in education and helping to train, you know, what the paradigm is going to be. So I think the educational paradigm is going to change. I think the way we certify, and you know, we're going to competency-based medical education. I don't see the time training change. It might, and I think competency-based education is actually helpful for the resident who's actually very skillful. We've always focused on the person who needs a little bit of extra help, but I think competency-based education will actually help promote those residents and fellows who are superb. They don't need to get the 25 cabbages because they already know how to do it out of 10. And so they can progress faster. So much like other countries like Canada, we may be losing time-based training. So, so that's one aspect. So I think everything, you know, things will be different in 30 years, and so I wish I would be around to see it.
You'll be on the golf course.
Yeah, I don't play golf.
So we just had a structural session on surgeons should stay in the structural game, and we should be educating, you know, residents and fellows on all the transeptal techniques, and all of that education, as you know, will take a lot more specialization and a lot more educators. I've always looked up to you, and I really appreciate everything you've done for our specialty,
Well,
and always
great.
being accessible. And thanks for being our guest on Same Surgeon, Different Light today. I should add that Dr. Erkmen had to step out early to prepare for the plenary, and we really appreciate you being here with us, and we appreciate STS hosting the Same Surgeon, Different Light podcast series.
Thank you.
This has been Same Surgeon, Different Light, a podcast brought to you by the Society of Thoracic Surgeons. Thank you for listening. If you like this podcast, please rate it 5 stars and let your friends, trainees, and colleagues know about it. On social media, you can use the hashtag #TheFaceOfCT Surgery. And for more information about the Society of Thoracic Surgeons, you can go online at sts.org.